Neuroblastoma is a rare and aggressive type of cancer that develops from the mature nerve cells neuroblasts and primarily affects young children. It typically arises in the adrenal glands, located above the kidneys, but can also occur in nerve tissue along the spine, chest, abdomen, or pelvis. Neuroblastoma is the most common cancer in infants and the third most common cancer in children, after leukemia and brain tumors. Key facts: age group. Most commonly affects children under the age of 5, though it can occur in older children and, very rarely, in adults. Origin: develops from neuroblasts, early forms of nerve cells found in the fetus or embryo. In most cases, these neuroblasts mature into nerve cells or disappear by birth, but in neuroblastoma, some continue to grow uncontrollably. Common locations: adrenal glands, but also in the abdomen, chest, neck, and along the spine. Causes and risk factors: the exact cause of neuroblastoma is not well understood, but a few factors may increase risk. Genetics. In most cases, neuroblastoma is sporadic, not inherited. In rare cases, it can be familial, with inherited genetic mutations increasing risk. Some children are born with genetic changes, mutations in neuroblast cells that cause them to grow abnormally. Age: it most commonly affects children under 5, with the average age of diagnosis being around 1 to 2 years old. Genetic syndromes: a small number of neuroblastoma cases are linked to hereditary cancer syndromes, like Beckwith-Wiedemann syndrome or Li-Fraumeni syndrome. Symptoms: neuroblastoma symptoms vary depending on the location of the tumor and whether it has spread. Common symptoms include abdominal symptoms when the tumor is in the abdomen or adrenal glands, swelling or a lump in the abdomen, abdominal pain, loss of appetite or weight loss. Chest symptoms when the tumor is in the chest, breathing difficulties or chest pain. Horner syndrome: drooping eyelid, small pupil, lack of sweating on one side of the face, persistent cough. Spine symptoms when the tumor presses on the spinal cord, weakness in the legs, difficulty walking or paralysis, changes in bowel or bladder function. Other symptoms: bone pain, especially if cancer has spread to the bones. Lumps under the skin, blue or purple skin lumps, often due to cancer spreading. Fatigue and pallor, due to anemia if the bone marrow is affected. Fever, recurrent fevers without a clear cause. Paraneoplastic syndromes rare. Some children develop dancing eyes syndrome, rapid eye movements and difficulty coordinating movement. Opsoclonus myoclonus syndrome, characterized by rapid eye movement, jerky muscle movements, and irritability, linked to the body's immune response to the tumor. Diagnosis: diagnosing neuroblastoma typically involves several steps, including physical examination. Doctors check for lumps, abnormal reflexes, or other symptoms. Imaging tests. Ultrasound, often the first test if an abdominal mass is suspected. MRI or CT scan, to get detailed images of the tumor and assess whether it has spread to other areas. IPG scan, a specialized imaging test that uses a radioactive substance to detect neuroblastoma cells throughout the body. Biopsy. A tissue sample from the tumor is examined under a microscope to confirm the diagnosis. Bone marrow biopsy, if there is a concern that cancer has spread to the bone marrow. Urine tests. Neuroblastoma cells release certain chemicals, catecholamines, that can be detected in the urine. Elevated levels of vanillin-mandelic acid (VMA) or homovanillic acid (HVA) in the urine are common in neuroblastoma patients. Genetic testing. Tumor samples are tested for genetic mutations or abnormalities, such as NYCN amplification, which indicates a more aggressive form of neuroblastoma. Staging. Once neuroblastoma is diagnosed, doctors determine how far the cancer has spread. Staging. The stages help guide treatment and prognosis. Localized stage 1 and 2. the tumor is confined to one area and may be fully or partially removed through surgery. Stage 1. The tumor is completely removed. Stage 2. The tumor cannot be fully removed but has not spread. Locally advanced. Stage 3. The tumor has spread to nearby lymph nodes but not to distant parts of the body. Metastatic. Stage 4. The cancer has spread to distant parts of the body, such as bones, liver, or skin. Stage 4's special stage. This stage occurs in infants under 1 year old. The cancer has spread but behaves differently from typical stage or neuroblastoma and can sometimes regress without intensive treatment. Treatment for neuroblastoma depends on the stage of the disease, the child's age, and other factors like genetic markers, e.g., MYC and gene amplification. It often involves a combination of therapies. Surgery. Surgery is often the first step, especially if the tumor is localized and can be completely removed. In more advanced cases, surgery is used after other treatments to remove as much of the tumor as possible. Chemotherapy. Chemotherapy uses drugs to kill cancer cells and is commonly used in advanced neuroblastoma or when the tumor is difficult to remove with surgery alone. It may be administered before surgery neoadjuvant to shrink the tumor or after surgery adjuvant to target any remaining cancer cells. Radiation therapy. Radiation may be used to shrink tumors or kill cancer cells that remain after surgery or chemotherapy. It's often reserved for high-risk or advanced cases where surgery and chemotherapy alone are not enough. Stem cell transplant. High-dose chemotherapy, followed by a stem cell transplant, is used for high-risk neuroblastoma. The child's own stem cells, autologous transplant, are harvested, and after chemotherapy, the stem cells are reintroduced to help the body recover. Immunotherapy. Anti-GD2 antibody therapy, e.g., dinutuximab, is used to target neuroblastoma cells. It's often combined with other treatments in high-risk cases. Immunotherapy helps the child's immune system recognize and attack cancer cells. Retinoid therapy. Retinoids, such as 13,6-retinoic acid, are used after other treatments to help prevent recurrence by encouraging cancer cells to mature into normal nerve cells. Clinical trials. Children with neuroblastoma may also be eligible for clinical trials offering new, experimental treatments. Prognosis. The prognosis for neuroblastoma depends on several factors, including the child's age, the stage of the disease, and genetic factors such as MYC and amplification. Children diagnosed at younger ages, particularly under 1 year old, tend to have a better prognosis. Low-risk neuroblastoma. These cases, often in infants or children with localized tumors, have a high survival rate greater than 90% with appropriate treatment. Intermediate risk neuroblastoma. These children have a moderate survival rate, depending on how the cancer responds to treatment. High risk neuroblastoma. Advanced stage neuroblastoma with MYC and amplification or metastatic disease has a lower survival rate, though outcomes are improving with advances in treatment. Long-term outlook and follow-up. Children treated for neuroblastoma require long-term follow-up care due to the risk of recurrence. Even after successful treatment, neuroblastoma can sometimes return, particularly in high-risk cases. Side effects. Some treatments, especially chemotherapy and radiation, can have long-term effects on growth, fertility, and cognitive development. Survivors may need ongoing monitoring for late effects of treatment. Conclusion. Neuroblastoma is a complex and challenging pediatric cancer, particularly in its high-risk forms. Early diagnosis and treatment are crucial for improving outcomes. Advances in multimodal treatments including surgery, chemotherapy, stem cell transplants, and immunotherapy have improved survival rates, particularly for low and intermediate risk patients. Ongoing research continues to offer hope for new therapies that may further improve the outlook for children with high-risk neuroblastoma.